Medicolegal aspect of ethyl alcohol. Consent of a drunk person. Alcohol and a road traffic accident. As a blood alcohol level rises to 30 to 50 milligram percentage, there is deterioration in a driving ability. Alcohol is a reaction time creates false confidence, impaired concentration and judgement, and produce muscular incoordination, decreases the visual and auditory acuity, which leads to accident. Stationary limit of Section 185 of Motor Vehicle Act 1988, amended in 2019, deals with driving by a drunken person or by a person under the influence of alcohol, whoever while driving has a blood alcohol concentration of more than 30 milligram percentage, that is 30 milligram per 100 ml of blood, dictated in a test by a breath analyzer or in any other test, including laboratory test, or is under the influence of a drug which makes him or her incapable to proper control over vehicle, shall be punished. That is, punishment is a 6-month fine or 6-month fine. 6-month fine and 10,000 rupees for first offence punishment, and if repeated 2 years plus 15,000 rupees. ഓക്കെ, 6 മാസവും പിന്നീട് ഫസ്റ്റ് 10,000 രൂപയും പിന്നീട് 2 വർഷവും 15,000 ആൽക്കഹോൾ കള്ളു കുടിച്ചാൽ ബ്ലഡ് ആൽക്കഹോളിൻ്റെ ഉണ്ടെങ്കിൽ. ഓക്കെ, നെക്സ്റ്റ് ഈസ് Section 202 of Medical Vehicle Act, Motor Vehicle Act. A police officer in uniform may arrest without warrant any person who in his presence commit an offence punishable under Section 185 of Motor Vehicle Act 1988. Section 203 of Motor Vehicle Act 1988 deals with a breath test to be conducted by a police officer on a suspected drunk person. The suspected person refuses to undergo breath test. Police officer may arrest him without warrant. Section 204 of Motor Vehicle Act 1988 deals with the laboratory test of a person who has been arrested under Section 203 of Motor Vehicle Act 1988 as above, to be conducted by a registered medical practitioner. The doctor can examine such arrested person without consent, Section 53 of CRPC, by applying a reasonable force if needed. Article 47 of Constitution of India prohibits the use of alcohol and criminal behavior. Incidents of suicide, homicide, accident increases in drug facilitated sexual assault. Alcohol has been used. Section 510 IPC, misconduct in public by a drunken person, punishable is a simple imprisonment for up to 24 hours or fine 10 rupees. Okay, some misconduct or something ചെയ്യുകയാണെങ്കിൽ പബ്ലിക്കിൽ. ഓക്കെ, ആൽക്കഹോൾ ആൻഡ് ട്രോമ. If a drunk person sustains a head injury resulting to extradural hemorrhage or subdural hemorrhage and dies after some days, the alcohol disappears from blood, but it will be still present in extradural hemorrhage or subdural hemorrhage. It is because the blood of the extradural hemorrhage and the subdural hemorrhage is clotted and confined in a closed space. It is not the part of circulation, and so alcohol level remains as it was. So in case of a delayed death, extradural hemorrhage or a subdural hemorrhage must be preserved and sent for chemical analysis. Fetal alcohol syndrome occurs if alcohol is consumed by a pregnant woman. If a husband is habituated of alcohol, it amounts to cruelty towards wife. Dipsomania, an excessive desire to drink alcohol. Alcohol Anonymous. It is an international self-support organization consisting mainly of ex-alcoholics who encourage one another to abstain drinking alcohol. It was established in the United States in 1925. Now has branches all over the world. Auto brewery syndrome. Gut fermentation syndrome is a condition in which excessive ethanol is produced in the GAT through endogenous fermentation in a patient suffering from intestinal candidiasis, Candida albicans. The patient may be arrested by a traffic police due to high level of alcohol in the blood. Fridays are specific days when the sale of alcohol is banned. National holidays as a Republic Day, January 26, Independence Day, August 15, Gandhi Jayanti, October 2 are usually dry days throughout India. Thank you.